In today's video, we're covering Chapter 13, in which we'll discuss the functional assessment of problem behaviors. Now, in the earlier chapters, we were describing procedures for establishing desired behaviors, things like shaping and promoting and so on. But now we're going to start talking about procedures for understanding specific problem behaviors and trying to increase or decrease the likelihood of existing behaviors occurring. So rather than trying to make new things happen, we're going to be looking at what's already there and how we can change what's already there. So the first step to changing an existing behavior is to understand why that person is currently engaging in that behavior to begin with. So that's where our functional assessment is going to come into play. Now, you might have noticed that there is no Chapter 12. Chapter 12 is sort of a niche discussion of applying different kinds of skills that may be relevant for employing some of the ideas we talked about in the earlier chapters. But I've chosen not to cover that during this course, so we're not testing on that chapter, we're not covering that chapter, so we're skipping straight from 11 to 13. So that's why we're continuing with 13 today. So as you may have figured out, a functional assessment is just an assessment where we're going to try and figure out our three-term contingency for a given behavior. We want to figure out what the antecedent events that evoke the behavior are, and what the reinforcing consequences are that maintain that behavior. So what causes that behavior to happen, and what keeps it happening? And so let's walk through the process of actually conducting one of these functional assessments. We're going to keep it fairly vague because all of these procedures follow the same basic steps, but can be adjusted and sort of customized for a given situation. Now, when we're starting out, we want to begin by identifying and then defining our target behaviors. So this would be some kind of functional definition, an operational definition, as it were. And so you want to decide, what are you looking at? What are the things that you are going to be studying? What are you trying to change here? So this is going to be a behavior that needs to be either increased or decreased. Maybe a child is spending too much time playing video games, or maybe they're not spending enough time doing their schoolwork. Most of these assessments are going to begin with an indirect assessment. So, for example, they'll sit down and conduct interviews. They'll get a feel for the situation by talking to people who are involved, either the individual who is exhibiting the behavior that needs to be changed, or those around them. So if it's a child with problem behaviors, they might speak to the parents. And so once the researcher knows what's going on, once they have that sort of base information, they can start collecting baseline data. Basically start observing the situation, see what's going on. This stage is usually done using direct assessment, which we'll talk about later on in this chapter. So once they've figured out where they're starting and they've started to collect some of that baseline data, they can then complete a functional assessment. So they can start looking at what are our antecedents, what are our consequences, and they can start making some hypotheses about what is it that's causing this behavior and what it is that's keeping this behavior going. So the next step is to develop and implement treatment. Given what we have decided about what may be causing and maintaining this behavior, how could we adjust this situation? How can we adjust this system to decrease the occurrence of that behavior? So once you've made that, sort of developed that system, developed a potential course of treatment, you can then implement that treatment. And of course, as good researchers, you want to evaluate the effectiveness of that treatment and how effectively you've implemented it. So let's look at this last step just a little bit more in depth here. So the first thing is, was the treatment effective? So you can ask yourself, did the problem behavior decrease and the desirable behaviors increase? Are they changing their behavior the way that you had intended? If yes, you can begin promoting maintenance and generalization. as we've talked about in earlier chapters, usually when you're trying to get a particular behavior to occur, you are reinforcing it a lot more regularly than it would be reinforced in everyday life. Maybe your methods are a little bit different. Maybe you're using continuous reinforcement instead of intermittent reinforcement. So if you've realized that your initial stages, your initial treatment has worked, you can then move to making it a more long-term and long-lasting change. So switch over from that continuous reinforcement to intermittent reinforcement. Switch from giving the child a food reward to giving them verbal affirmations or something like that. You also want to try and apply strategies to foster generalization. Get them to do that behavior, or get them to do the desirable behaviors in different environments. Get them to stop doing the problem behaviors in different environments. Rather than just having this apply in, say, a lab setting or a clinical setting, wherever you've done the initial training. And so if you can sort of move over to that intermittent reinforcement and you can foster generalization, then this change in behavior should apply to more situations, and it should be a much longer lasting change, which makes sense from what we've talked about in previous chapters. If your attempt to implement treatment has not been effective, the first thing that you want to check is your treatment fidelity. Basically, instead of just assuming that your treatment doesn't work, make sure that you actually implemented the treatment correctly. So we talked about in one of the previous chapters where parents who are supposed to be helping to extinguish a certain kind of problem behavior in their child, like self-harming behaviors, end up, instead of going through extinction by ignoring those problem behaviors, end up giving the child attention and causing an increase in those problem behaviors. That might be a misimplementation of an attempt at extinguishing those behaviors. So if you look at the treatment and decide, was this actually implemented correctly or did something go wrong? If the treatment was not implemented correctly, retrain the staff or the individual doing the treatment. This is why it's usually important to have a trained individual trying to do problem behaviors in more extreme cases. It's not always the best idea for just the parents on their own to try and do this. You might have to adjust the components or the procedures. Maybe you can set things up in a way that makes it easier to follow through with the same basic treatment plan, but with some changes that make it more effective. And then if you, instead of saying that, no, we made a mistake, the treatment wasn't put together properly, if you look at it and say, actually, yeah, we did everything right and it still didn't work, then we have to go back to step 3, which right here is to complete a new functional assessment. Maybe the things that you thought were antecedents and consequences weren't actually involved in maintaining this problem behavior. Maybe there's something else going on. So you can take another look at the situation, see if there's something else that might be involved, and develop and implement a new treatment that you can then critically evaluate again. Okay, so that's our roadmap for these functional assessments. Let's actually walk through in a little bit more detail and look at all the stages in between. So the first thing that we want to look at is, what exactly is it that we're assessing? In that first stage, when we're looking at this situation, what are we looking at? And when we've talked about the 3-term contingencies, we've already kind of mentioned the importance of the antecedents that precede our behavior and the consequences that come out of our behaviors. So I've just stuck that ABC diagram from the earlier chapters just in the bottom corner here as a little bit of a reminder. But let's start with our antecedents. So we want to evaluate where, when, with whom, and in what circumstances or situations does our behavior occur. Basically, what's the environment in which this behavior is happening? So we can look for our SDs, our discriminative stimuli, our S deltas, sort of hand in hand with those SDs. We might also want to look for motivating operations, things like establishing and abolishing operations. Basically, we're identifying all of the contextual stimuli, the preceding behaviors and circumstances, maybe even time of day, whatever is going on in that environment that might be making it possible or making it more likely that that behavior is going to occur in that situation. So then, of course, we want to look at our behavior. As I said, we want to identify what is that problem behavior and what are some alternatives to that problem behavior. It's a lot easier to train someone out of a particular problem behavior if you can give them an alternative behavior instead. We also want to try and identify some of the variables that might be relevant to this behavior occurring. So how intense is it? When does it happen? How does it happen in relation to other events? Where does it occur? Things like that. So as much information as you can get about that problem behavior, you want to collect all of that together so that you can start from an informed place. And then lastly, we have our consequences. And you definitely want to identify not just consequences of the problem behavior, but also consequences of our alternative behavior, the thing that we want them to start doing instead. And we can separate out social consequences, basically what effect does this have on other individuals, or what will other individuals do in response to this behavior. We might also have environmental or automatic consequences, like self-harming behaviors will have the automatic consequence of causing self-harm. We should also consider the schedule of reinforcement. So if we're looking at this reinforcement as our consequence, we want to know when it's being reinforced. Is it always reinforcing, or is it only sometimes reinforcement? What's the magnitude of the reinforcement? How intense is it? How immediately is it delivered? Is there a delay? Again, all of these different factors should be taken into account when we're designing our method of treatment to try and get shift away from this behavior, or if we're trying to identify these different ideas of reinforcement for alternative behaviors that might help us figure out if that's going to be something we can shift away from problem behaviors towards. So we basically want to know as much as we can about the whole situation, about our whole 3-term contingency system, in order to move forward with as much knowledge as possible. The textbook distinguishes between 4 different categories of reinforcement, or functions of problem behavior. And these are called functions of problem behavior because these are 4 types of things that can be a consequence of that problem behavior. This is what the individual performing that problem behavior is getting out of that situation, as it were. So we can talk about social positive reinforcement, social negative reinforcement, automatic positive reinforcement, and automatic negative reinforcement. So we already know the positive and negative reinforcement side of things, so that's going to be good. We're just going to introduce the difference between social and automatic to sort of pick apart these 4 different options. So when we're talking about social reinforcement, whether it's positive or negative, social means that it's reinforcement that's coming from other individuals. It's coming from somebody else. So positive, social positive reinforcement would be something like attention, praise, reactions to that behavior, activities, things that you are given. And these are all things that are mediated by others, not by the individual performing the problem behavior. Negative or social negative reinforcement would involve things like getting to escape from a task or activity or interaction. And again, this is mediated by others. So an example of social positive reinforcement is when a child is exhibiting self-harm behavior, if their parent gives them attention, tells them to stop, and sits with them and comforts them, that is social positive reinforcement because they're getting that attention. An example of social negative reinforcement would be that a child throws a temper tantrum. They scream and they cry because they don't want to do a particular task. And because the child is so upset, they're allowed to stop engaging in that task. So they escape from performing that task. So that is negatively reinforced because they don't have to perform the task after doing that behavior. When it comes to automatic reinforcement, again, positive or negative, the reinforcement is a natural consequence of the behavior. So specifically, it's not being mediated by other individuals. Things that fall under this category would be sensory stimulation, environmental stimuli, and events. An example of this would be, say, a child throws a toy on the floor and it makes a sound and they enjoy that sound. That could be sensory stimulation. For automatic negative reinforcement, this could be things like relief from pain, anxiety, or other aversive stimulation, escape from aversive environmental stimuli, and again, not mediated by others. So maybe an individual has OCD, and by performing different compulsions, it lessens their anxiety. So that would be automatic negative reinforcement of those compulsive behaviors. So for these 4 different options here, we still have positive and negative for our reinforcement. They can just now be automatic or social based on whether they are mediated by others or not. Okay, so let's move on to a couple examples of identifying antecedents and consequences. So in all of these examples, the behavior is that a 4-year-old child throws a temper tantrum. And so we have different examples where we can identify a potential antecedent and a potential consequence that would explain this temper tantrum behavior. So one example would be that the antecedent is that a parent makes a request during the preferred activity. Maybe the child is playing video games and the parent asks them to clean their room. So the child throws a temper tantrum, the behavior in the middle there, and the consequence is that the child escapes from performing the requested activity and gets to continue their preferred activity. So in that situation, the parent asks the child to stop playing video games and go clean their room. The child throws a temper tantrum, and the parent gives in, allowing the child to continue playing their game, and they get out of cleaning their room. Now, just for the first one here, I'm going to walk you through it, where if you wanted to start thinking about this in terms of, say, an assessment, we might ask, okay, well, what kind of reinforcer is that, or what kind of reinforcer is shown in that situation? And so it's something to do with social, because the parents are involved, and we can say that they're escaping from performing that task that they don't want to do. They're escaping from that requested task, so we could call this social negative reinforcement. So we know that it's mediated by others, the parents, and they escape from that particular task, so that's what this one is. So for each of these, you could go through and actually think about what kind of situation is this? What kind of reinforcement are we seeing for each situation? So for example 2, we'd have our antecedent of the child told he can't have something. Maybe he's asking for a particular toy and the parents say no. The behavior is throwing a temper tantrum, and the consequence is that they get the thing they've asked for. So again, what's going on there? We know that he's getting something he asked for, so it's some kind of positive reinforcement, and then you decide if it's socially mediated or automatically mediated. And in this case, it's probably because of the parents, so it's social. Social positive reinforcement. Example 3 is antecedents. We have a teacher who's busy with other students. The child throws a temper tantrum, and as a consequence, the teacher directs attention to the child, which is very similar to the previous example. Instead of getting a physical thing, they get attention now. So it could still be social positive reinforcement there. And again, similar here, where teacher makes an academic demand, child throws a temper tantrum, and then the teacher provides extended interaction and assistance. Basically, they get attention after throwing their temper tantrum. And example 5, siblings touches toys, so he throws a temper tantrum, and as a result, the siblings stop touching his toys. So these are all examples of identifying the antecedents and consequences that go along with our tantrum behavior. A slightly different scenario, we can look at a 17-year-old who pulls their hair. And so in this situation, for example, 1, the antecedents, the situation that they're in is that they're alone and watching TV. So they sit there and they're pulling their hair. And the consequence, they might not be getting attention or anything like that, but the consequence might be as simple as tactile stimulation. So that's an automatic rather than social kind of reinforcement. Example 2 would be that antecedents, again, watching TV, but this time their mother is busy in the room. So when they start engaging in that hair pulling behavior, the consequence this time is that they get attention from their mother. So instead of being an automatic reinforcer, this is now going to be a social reinforcer. So one change can adjust what kind of reinforcement we're seeing in that situation. All right, so the next couple of slides are going to discuss, again, more of the specifics of what we had talked about at the very beginning in order to conduct functional assessments. So these are going to be different methods that allow us to actually do the conducting of these functional assessments. So as I said, early on, you usually want to conduct some kind of indirect assessment where you can figure out what's going on in the scenario. So these indirect assessments are sometimes called informant assessments, and they generally involve things like behavioral interviews, questionnaires and rating scales, some kind of way of asking people for information. Now they're called informant assessments because you're usually getting information from either the individual who's exhibiting those behaviors or people who know that person well, those people being informants. As you can imagine, there are some downsides to using this kind of assessment. So things like low reliability, things like bias or inaccurate or incomplete information. Basically, we're relying on others' memory of events, their recollection. So the information that they give us might be incorrect because they've either forgotten it, they're misremembering it, or maybe even they're biased based on who we're asking questions about. Despite these potential problems, indirect assessments tend to be a very useful starting point. That's why it's usually one of the earliest steps in conducting a functional assessment, because it gives us an idea of what kind of patterns of antecedents and consequences we are experiencing in this particular situation. They can allow us to start developing a hypothesis. But these are usually most effective when paired with something like direct assessment methods, which we'll talk about in just a couple of slides. But sometimes it's just only practical to use this form of assessment. As we'll talk about, there are lots of downsides that come with direct assessment as well. And the benefit of indirect assessments is that they tend to be fairly inexpensive. They're easy to conduct. They don't take much time. They don't take a lot of manpower. So they tend to happen fairly often, and sometimes they're the only form of assessment, even if that's not the best course of action. But yeah, so at the side here, we have different categories of questions that you could be asked. Things like looking at the behaviors. So you can ask someone to describe the behaviors. What are the behaviors of concern? For each behavior, define how it's performed, how often it occurs, how long it lasts, so on and so forth. So we can break down all of these types of questions into some broad categories. So, like I just described, we can start by talking about the problem behaviors. First step in our checklist at the very beginning of this chapter was identify the problem behaviors. So we want to describe all the behaviors involved in the problem and figure out maybe there's a predictable sequence of behaviors, which could help us identify some of those antecedents and maybe even some consequences. And the textbook talks about the usual method of recording this is to have a 3-column worksheet where you can have your antecedents in one column, your behaviors in another, and then your consequences in the last column, so that you can actually see that potential progression from antecedent behaviors or antecedent situations to the behaviors to the consequences. Speaking of antecedents, we can ask questions about when, where, and with whom does the problem behavior occur? What circumstances, situations, or activities lead to the problem behavior? Are there emotional or behavioral predictors of the problem behavior? And is the problem behavior related to medication, medical condition, pain, discomfort, problems with sleep, other biological factors, or other settings? Whew, quite the list. But basically, all of these questions are trying to get at potential sources, potential stimuli that could be precipitating our problem behaviors. And that's the point. We're identifying antecedents, so we want to ask questions that get individuals to think about what might be setting up a situation where those problem behaviors occur. And then, of course, we can look at our consequences and we can ask questions like, what happens when the problem behavior occurs? How do people react? What does the behavior get for the child? What does the child escape or avoid by engaging in this behavior? So again, figuring out what it is that they're getting from this situation, what is our reinforcer in this particular moment? And the last thing that we want to think about for these indirect assessments is our alternative behaviors. So if you don't want them doing that problem behavior, what do you want them to do instead? Would that alternative be a desirable method of displacing that problem behavior? Is the child capable of engaging in this alternative behavior? And what is currently preventing this alternative behavior from occurring? So getting a feel for how we might start shifting from the problem behavior to the alternative behaviors. So these questions are meant to be a little bit open-ended in a lot of cases. You can have more specific questionnaires, and lots of pre-made questionnaires just like these already exist that can help facilitate some of these functional assessments. But as I had mentioned, our indirect assessments are not the only way of assessing this behavior, the only way of setting up a functional assessment. We can also have direct observation assessment, sometimes called ABC observations, because we're trying to have a descriptive recording of our ABCs, the antecedents, the behavior, and the consequences. Now, usually this direct observation assessment is going to come after our indirect assessment. And that's because the indirect assessment can actually point us in the right direction as to when we might get the most information out of a direct observation assessment. So if we know that the problem behavior only occurs in the morning from our indirect assessment, then maybe we would only choose to try and conduct a direct observation assessment in the morning when that behavior is more likely to occur. So we have three broad types or three different ways that direct observation assessments are usually conducted. So you can go with a straight descriptive recording of the ABCs, you can go with a checklist recording, or you can go with interval recording. We actually have diagrams for each of these on the following slides. So with our descriptive ABC recording, it's kind of what it sounds like. Again, we're going to have three different columns that are similar to what we just talked about. So what happened just before the behavior, so trying to identify potential antecedents, the behavior itself, what was done or said, with lots of descriptive details, our behaviors, and then what happened just after the behavior, trying to identify potential consequences. And in this situation, we would specifically record the exact date and time at which this all happened. Now, this whole setup here is fairly open-ended because the observer can write down whatever occurs to them. So they might have more information than they need, or they might even have missed something. So when conducting a descriptive ABC recording, you usually want highly trained recorders, people who are observing and who know how to observe so that they're not missing anything or including more information than you need, though you usually err on the side of more information is better. Our next option is checklist recording. So this is going to be a little bit less open-ended than our last option, but we typically have a checklist where we've identified potential behaviors, antecedents, and consequences, usually from an indirect assessment or even through something like a descriptive recording session. And so we can have lists of these are the possible behaviors that we're watching for. These are some of the potential antecedents that we have identified that might be involved. And these are the potential consequences that might follow. And so just how this would happen if we were actually observing using this checklist, we would observe this particular behavior. I think that says that the child screams. And then we move across, so that's the behavior we have observed. The antecedents at the time is that the teacher is helping other students. And then our consequences, the teacher provides attention and other students are providing attention. And so the person who made the observation, initials RG, and the time at which they made that observation. So with this setup, this might be a lot faster than having to longhand write out that if we were here, that the behavior was the child is screaming and the situation that happened before and what happened immediately after. If these are things that are happening regularly, having this checklist set up actually saves you time because instead of having to write stuff out again and again and again, you just put in a check mark, which is pretty nice. Now, whereas the other two methods allowed us to note the exact time that each instance of a particular behavior occurred, this third and final of the methods we're discussing here in interval recording isn't going to give us a precise time. Instead, we're going to break down our observation period into brief time intervals, so a set start and end, and then we're just going to tally up how often a given behavior occurs within that time window, within that interval. And so you can mark on this sheet sort of how often that behavior occurs. And so in this particular instance, it's set up so that one horizontal line through that box tells us that the behavior occurred once, whereas a solid filled in box tells us that that behavior occurred twice or more. And the way that this diagram is set up, everybody would pick their own ideal setup, but for this situation, they're looking at days across the bottom, so each column is one day, and we start at 9 a.m. and we go to 11 p.m. So we're tracking when are these behaviors occurring, each square being a half-hour window. And so in this particular diagram, we're seeing that this behavior is most likely to occur at 3 p.m. So if this is in a child, maybe it has something to do with the end of the school day or something like that. Now, regardless what kind of methods you're using, there are a couple of things you want to keep in the back of your mind, things you need to consider. These are reactivity, how the individual's behavior might be changing based on your presence as an observer. Things like practical and ethical feasibility. Is this something that it's okay for you to sit in and watch? Or is it something where you ethically should be intervening? If a child is causing themselves harm, maybe you are obligated to step in. For practicality, is it practical for you to sit there for long periods of time to observe this? Or are you restricted to maybe only being able to conduct an indirect assessment because a direct assessment isn't practical? If that's the case, you might have to get into recruiting informants to either conduct an indirect assessment, or maybe you can have individuals who are usually in that environment that you can recruit to help with direct assessments. So maybe it isn't viable for a researcher to come into that environment, but maybe there's someone who's already there who could maybe use a checklist to keep track of when certain behaviors occur or something like that. So just some things to consider in the background. The next thing that we want to consider is the fact that all of our assessments that we've just talked about show us potential antecedents, behaviors, and consequences. But what we're getting out of that information is really just correlational data. We don't have any indication of sort of a functional relationship We don't know that a particular antecedent situation is leading to that behavior occurring. We just know that they tend to occur close together in time. So if we want to be more confident in that functional relationship between a particular antecedent and a behavior, or even between a behavior and a particular consequence, we might want to conduct what's called a functional or experimental analysis. Now, this is important to note that this is a type of assessment. This isn't intended as treatment. This is us trying to determine a functional relationship between our ABCs. So we're trying to manipulate the variables of this system in some way to demonstrate a functional or causal relationship between some of those variables. So if you remember back to the beginning of the semester when we were talking about different experimental designs, or even on our assessment, our recent assignment, where if you have an A-B design, you don't have any replication, and we can't have any kind of idea of causality or a functional relationship. So if you want to have that functional relationship, if you want to know that A leads to B, which ends up causing C, then we want some kind of replication. So if we have AB and then repeated AB again, we would be more confident in that causal relationship or that functional relationship between our A and our B. So how do we actually conduct a functional analysis? Again, it's going to change a lot depending on the situation, but the bare bones of it is that you're going to manipulate your antecedents. Maybe you're going to look at possible motivating operations, things like establishing and abolishing operations. Or maybe you're just going to change some other aspect of the environment that might be an antecedent in that particular situation. You might also choose to manipulate some of the consequences. See if you can adjust the possible reinforcers in order to see if that changes what's happening with the behavior. And you want to replicate this. So you want to see that if you can manipulate the environment in which this behavior might occur. Things like, let's go back to the example of a child throwing a temper tantrum to get their parents' attention. You can manipulate whether the parent is paying attention to the child or not, and see if the child is more likely to engage in that temper tantrum behavior when the parent is already paying attention to them or when the parent is intentionally ignoring them. You can then also change up the consequences of whether the parent gives attention after the temper tantrum has been performed or not, to see if that changes that child's temper tantrum behavior. And the more replications of this, the more you can see that this happens consistently together, the more confident that we can be that those are related. Now, we tend to see two different types of functional analyses. We can have an exploratory functional analysis where we basically don't know what's going on and we have a bunch of possible antecedents and a bunch of possible consequences, so we want to test a range of possible functions. Basically, we're exploring to see what might be most closely related to this particular behavior. We might also see a hypothesis testing functional analysis, where we already have a hypothesis from our descriptive assessment at the very beginning of our stages here. So maybe by conducting our interviews or by observing the behavior, we've figured out that there's a likely antecedent and a likely consequence, and we want to conduct a functional analysis to just confirm that there is some kind of causal relationship between those ABCs that we've identified. So one is a little bit more broad and basically checking out what might be going on, and one is more specific, trying to confirm a precise prediction. Regardless of the type of functional analysis that you're conducting, whether it be experimental or hypothesis testing, for each of your test conditions, you're going to be presenting the hypothesized EO, or establishing operation. So you want to present the thing that you think might be an antecedent of that behavior. So for each test condition, you'll have a different EO that you want to test. And then you want to deliver one of the possible reinforcers for the problem behavior. So in that child temper tantrum example I was just using, we could present the EO of the parent ignoring the child. And then if the child throws a temper tantrum, we could deliver the reinforcer of the parent giving the child attention. If we had other things that we might think was involved, we could present those EOs instead in a different test condition. For our control condition, we want to present an AO, or an abolishing operation. So with our example, we could have the parent now giving the child attention to begin with. And then if the problem behavior occurs, we don't deliver a reinforcer. And if this EO that we have identified and the reinforcer that we've been using is the same one that's involved in the system, we should see more of that problem behavior occurring in our test conditions and less of it occurring in our control conditions. Now, for our examples, we've talked mostly about attention, sort of wanting attention, and as a consequence, getting attention after performing some kind of problem behaviors. But there are other sort of common sources that crop up, common motivators that seem to occur with a lot of problem behaviors. So sometimes there's an intent of getting something tangible, so a child throwing a temper tantrum to get a physical item like a toy. If they don't want their siblings to take their toys or something like that, something tangible. We often see problem behaviors arising to try and escape, as we showed at the beginning, escaping from having to perform a task that they don't want to do, or escaping a situation that they don't want to be in. And the last of the most common types of conditions that we'll see is when we obtain automatic reinforcement. And those are usually situations where performing that action makes the individual automatically feel better. Things like completing compulsions to lessen anxiety, or pulling on the hair because the tactile stimulation feels good, or something like that. So there are a couple of different things that tend to occur fairly commonly when we're looking at this kind of literature. These are common drivers of problem behaviors. Now, I've already kind of gone over this in the previous slide, differentiating between our exploratory functional analysis and our hypothesis testing functional analysis. But this is just sort of a more complete breakdown of what I said verbally, I believe. So with our exploratory functional analysis, we're not quite sure what's going on, so we have lots of different options that we're testing. So when you're conducting an exploratory functional analysis, you want to separate the data between our testing groups and our control groups. And if we see a gap or separation between what we observed for our testing and our control groups, then that's going to indicate that there's some kind of function involved there. So with our temper tantrum example, if we see more temper tantrums being thrown when the parent is not paying attention to the child, and fewer when they are paying attention to their child, as our EO and AO at the beginning, then we would say that attention serves some function in that particular situation. If we happened to see data elevation across all test conditions, so if we had multiple EOs and all of them showed a raised occurrence of this problem behavior, then that tells us that there are either multiple functions, multiple of these things motivating the situation, or there's some kind of automatic reinforcement, because automatic reinforcement isn't going to change based on that external adjustment. So even if you change attention, some tangible or some kind of escape, if it's automatically reinforcing, those won't necessarily be relevant. But in situations where you see that elevation across all of our test conditions, it tells us that something else instead of one specific thing might be going on, or automatic reinforcement because that one thing is special because it's internally motivated. And a way to differentiate between multiple functions being involved, or if it's just automatic reinforcement, is you can have an extended alone condition. So you can remove other EOs, so remove the parent who might be giving them attention or not, and see if we see an increase in that problem behavior when they're by themselves. If we do, then it's going to be automatically reinforcing for some reason that's internal to that individual. And so all of these different options are important with our exploratory FAs because that's where we're looking at multiple options all at once. And our hypothesis testing FAs, we're just telling the difference between one test and one control. So we would expect to see a separation in the data between the test and the control conditions. And if we don't, then our hypothesis is wrong, and we should probably conduct either an exploratory FA or go back to our assessments to figure out what else might be going on. Now, these last 4 slides just before my summary page are meant as a test yourself moment. So I'm going to sort of flip through these nice and slowly so you can read through them or look at them on your slides if that's easier. But this is just to see if you can look at a situation. We've already identified our problem behavior, but could you identify some alternative behavior? What's our antecedents? What's our reinforcing consequence? And then I'm not going to provide treatment options for you, but is there something that you could think of that might be a good option going forward? This is the sort of thing you might expect to see on an examination, where you'd be given a situation and you might have to pick out what are our antecedents, what is the potential reinforcing consequence, and so on. So for each of these, we have just the setup with all the blanks, and then I give you the answer. So test yourself and see if you can get close to the same there. And then a second example. Another problem behavior here, this time non-compliance instead of just general, disruptive behavior. And then you can work it out. What are the antecedents, reinforcing consequences, and alternative behavior? Again, with the answers. And so this brings us to our final thoughts. And this is just sort of a reminder that, as always, we are not assessing an individual. Same as earlier on, talking about we are not modifying an individual. We are assessing an individual's behavior. The intent is to change a behavior. You are not assessing people. You are not changing people. We are just focusing on their behaviors and how we can adjust those behaviors. So it's just a really common mindset to get into this idea of we are assessing individual A and we're changing behavior B. And so on, but we're always focusing on the fact that we're trying to assess an individual's behavior. We're trying to change an individual's behavior. It's not the individual itself who is being assessed and changed, just the behaviors that they're exhibiting. Just an important clarification to make and to keep in mind. But we will end at that point and we'll move on to chapter 14 in the next video.